Septic arthritis is an orthopedic disease. Look at this picture, shows that knee joint damages in cartilage and X-ray findings. Look at this. Then CT scan and MRI findings. Detail going on. Introduction. Septic arthritis, also known as infectious arthritis. It is a joint infection that causes inflammation due to the presence of a pathogen, typically bacteria, in the joint space. It is a medical emergency because the infection can lead to rapid destruction of cartilage and bone, resulting in severe joint dysfunction and potentially life-threatening complications if left untreated. Definition. Septic arthritis refers to an infection in the joint space caused by microorganisms such as bacteria, virus or fungi. Bacteria are the most common cause, particularly Staphylococcus aureus. Types. 1. Bacterial septic arthritis. Most common causes primarily by Streptococcus aureus and Streptococcus species. 2. Viral septic arthritis, less common, caused by virus such as hepatitis B, hepatitis C and HIV. 3. Fungal septic arthritis, rare, often seen in immunocompromised patients, caused by fungi like Candida species. 4. Gonococcal arthritis, a form of septic arthritis caused by Neisseria gonorrhoeae, typically affecting sexually active young adults. Causes. 1. Bacterial infections. Common pathogens include 1. Streptococcus aureus, Streptococcus pyogenes. 3. Neisseria gonorrhoeae. 4. Gram negative bacteria. 2. Viral infection, virus such as hepatitis B, C, HIV and mumps. 3. Fungal infection, common in immunocompromised individuals. 4. Direct joint inclusion through surgery, trauma or injection. 5. Hematogenous spread, bacteria enter the bloodstream and infected a joint, especially in patients with underlying infection elsewhere. Example: skin, urinary tract. Risk factors. 1. Age. Infants and elderly individuals are at high risk. 2. Joint conditions. Pre-existing joint disease such as rheumatoid arthritis or osteoarthritis. 3. Immunocompromised state. HIV, diabetes, cancer treatment and immunosuppressive medications. 4. Joint surgery or trauma. Recent joint surgeries or penetrating injury increases the risk of infection. 5. Intravenous drug use increases the likelihood of blood-borne infection. 6. Prosthetic joint. Higher susceptibility in patients with joint replacements. Complications. On joint destruction, rapid cartilage and bone damage can lead to chronic pain and disability. To osteomyelitis, infections spreading to nearby bone. 3. Sepsis. The infection can spread into the bloodstream, causing life-threatening systemic infection. 4. Functional disability. Permanent loss of joint function due to damage. 5. Chronic arthritis. Persistent joint inflammation even after treatment. Pathophysiology. The infection begins when microorganisms enter the joint space, leading to an acute inflammatory response. Neutrophils and other immune cells infiltrate the synovial membrane, releasing enzymes that destroy the joint cartilage and surrounding bone. The synovium becomes thickened, producing excessive synovial fluid, causing swelling and increased pressure within the joint capsule. If untreated, the inflammation can lead to joint destruction and systemic infection. Pathophysiology of septic arthritis step-by-step process. 1. Entry of pathogens into the joint. Hematogenous spread. Direct inoculation. Spread from adjacent infection. 2. Inversion of the synovial membrane. 3. Acute inflammatory response. Recognition of pathogens. Neutrophil recruitment. 4. Release of inflammatory mediators. Cytokines causing an intense inflammatory response. 5. Cartilage and bone damage. Enzymatic destruction. The synovial thickness. 6. Formation of pennus. 7. Joint effusion and impairment of joint function. 8. Systemic involvement. 9. Complications. Joint destruction, osteomyelitis, ankylosis. This step-by-step process illustrates how septic arthritis leads to joint damage, systemic involvement, and potential complications if left untreated. Signs and symptoms: 1. Acute onset of joint pain, severe pain, typically affecting a single joint. 2. Swelling. The joint become visibly swollen due to synovial fluid accumulation. 3. Erythema and warmth, redness and increased temperature over the joint. 4. Fever and chillness, systemic signs of infection. 5. Limited range of motion, joint stiffness and difficulty moving the affected joint. 6. Fatigue and malaise, general feeling of illness. Diagnosis: 1. Synovial fluid analysis. Joint aspiration is performed to analyze the synovial fluid for white blood cells, bacteria and crystal content. High white blood cell count and the presence of pathogens confirms SEPTIC arthritis. 2. Blood culture to identify the causative organism, especially if there is systemic infection. 3. Imaging study. A. X-ray may show joint space narrowing but not very sensitive early in the disease. B. Ultrasound helps detect joint effusion and guide aspiration. C. MRI useful in identifying joint and soft tissue involvement. 4. Laboratory test. Elevated ESR, CRP and white blood cell count indicating systemic inflammation. Nursing diagnosis: 1. Acute pain related to inflammation of the joint. 2. Impaired physical mobility related to joint inflammation and pain. 3. Risk for infection related to immunocompromised state or open wounds. 4. Hyperthermia related to systemic infection. 5. Anxiety related to severe pain and the diagnosis of potentially serious condition. Management: 1. Antibiotic therapy. Empiric blood spectrum antibiotics are initiated after joint aspiration and then tailored according to culture results. To joint drainage, aspiration, arthroscopy or surgical drainage to remove infected fluid. 3. Pain management, NSAIDs, opioid for severe pain and rest. 4. Immobilization, temporary joint immobilization to relieve pain and prevent further damage. 5. Physical therapy. Once inflammation subsides, early mobilization and rehabilitation to restore joint function. 6. Nutritional support, adequate nutrition to support immunofunction and healing. Treatment 1. Antibiotics, intravenous antibiotics for 2 to 4 weeks followed by oral antibiotics. To joint drainage, regular aspiration or surgical drainage. 3. Supportive care, pain management, fever control and rest. 4. Surgery in case of joint damage or failure of conservative treatment. Joint debridement or replacement may be necessary. Psychosocial medicine. 1. Emotional support. The acute nature of septic arthritis can lead to anxiety, fear and stress in patients due to pain and the risk of long-term disability. Emotional support and counseling may be necessary. 2. Patient education. Patients need to be informed about the importance of completing antibiotic therapy, joint care and the signs of recurrence. 3. Rehabilitation support, long-term physiotherapy and social support are essential for patients with severe joint damage to reintegrate into daily activities. Prevention 1. Prompt treatment of infection, early treatment of bacterial infection to prevent spread to joints. 2. Aseptic technique during joint injections or surgeries to prevent infection. 3. Prophylactic arthritis in patients with prosthetic joints undergoing invasive procedures for management of underlying conditions, control of chronic diseases such as diabetes and rheumatoid arthritis to reduce infection risk. 5. Hygiene and wound care, proper care of skin, wounds and prevention of trauma to joints. In conclusion, septic arthritis is a severe condition that requires immediate medical attention to prevent irreversible joint damage and systemic complications. Early diagnosis, aggressive antibiotic therapy and appropriate joint management are critical in preserving joint function and preventing life-threatening outcomes. Psychosocial support plays a vital role in managing the emotional and rehabilitation aspects of the condition. Thank you. Have a nice day.